Well, my friends, diabetes mellitus. What is the disease? Is there any scope in homeopathy? Yes, there is great scope in homeopathy. The disease which has no bacteria, bacillus, cocci, parasites behind it is simply metabolic disorders. But the health, general health of the patient becomes ruined, destructs. Diabetes mellitus. Is there any scope in homeopathy? We have enough scope in many cases. See, this is a case, a burning example of a case of the gentleman, age about 62 years. The first time when he came, the fasting was 369 milligram and PP or postprandial was more than 400 milligram. Just 1 month back, the patient came to me on dated 1912. There is mistaken in writing 1912, 19 December. Now after 1 month he has come, 20th January. The medicine was single lycopodium. Now sugar is reduced, 2 mass reduced. See, the blood sugar in the first date was 369 in fasting and 431 postprandial after lunch. Now it reduced 369 to 130 and 431 to 154. So this is greatly reduced. This test was done on 6th January. So improvement is there. So homeopathy has great scope to control the diabetes. But be careful. Diabetes mellitus is the disease. Is a disease composed of a group of metabolic disorders. একসাথে অনেকগুলো প্রবলেম ক্রিয়েট করে, অনেক সমস্যার সৃষ্টি করে। তাই একে বলা হয় দ্য ডিজিজ টেক্স দ্য ম্যান into the slow processing of suicide. Various genetic and environmental factors are responsible, and the result of which there is progressive loss of beta cells of pancreas or pancreatic functions. No beta cells is destructed, but the pancreatic functions may be reduced. Or both beta cells destruction and pancreatic functions are destroyed. That manifests clinically as hyperglycemia, and if uncontrolled, later associated with damage, dysfunction, and failure of multiple functions of multiple organs of the body. Failure of functions of multiple organs of the body. This is the defect. This is the mainly drawback. This is the demerit of this disease. Later on, it damages and dysfunction and failures multiple organs of the body, particularly the eyes, চোখ খারাপ হয়, কিডনি খারাপ হয়, peripheral and autonomic nerves, heart, small and large blood vessels, and also increases the risk of cardiovascular and cerebrovascular diseases, brain attack করে, heart attack করে, as well as cognitive decline. So diabetes mellitus, a very bad and worse disease. So there is absolute or relative lack of secretion of insulin from the pancreas, which affects the metabolism of carbohydrate foodstuffs, and also a lesser amount of fats, proteins, waters, and electrolytes. This is a great business, great mechanism, great factory. If we want to discuss about the production of sugar from the carbohydrates and how it has circulates into the system, blood, and how the sugar is deposited into the different parts of the body, a long chain, a long process. So in short, all carbohydrates such as rice, bread, potatoes, sugar, etc., broken down into the intestine and absorbed into the blood as glucose. Glucose is then carried to the liver, where it is stored as glycogen by the insulin, by the help of insulin. Only some amount of glucose is left in the blood for the provision of normal metabolism of the body. Hence, insulin plays a very important part in regulating how much glucose is kept in the blood for energy and how much is stored into the liver as glycogen. So it has been all written in Practice of Medicine. When the sugar in the blood rises above a certain level, the kidneys excrete the excess amount of sugar in the urine, which is called the threshold level of kidney. Hence, large quantities of urine are passed to get rid of the excess sugar. The excessive urination soon led to thirst, which is known as polydipsia. So the symptoms of diabetes mellitus graphically develops. Polyuria, that is excessive output of urine, occurs during the night as well as in the day. So excessive output of urine occurs during the night as well as in the day. And the polydipsia, that is excessive thirst, there is constant desire to drink. Polyphagia, that is excessive hunger, আগে খিদে বেশি হতো. Progressive loss of weight and strength, lack of energy and lassitude in some patients. Irritation of skin, especially itching of the genitalia, which is known as pruritus vulvi in case of obese females, are to be seen. Tingling sensation in different parts of the body, especially in fingers and feet, which is known as paresthesia. So there are other symptoms. So in short, I have briefly discussed about the diabetes mellitus. There are type 1, type 2, etc. One day in another video I shall discuss about all of diabetes mellitus.